Good morning once again. Myself is Professor Dr.R.R.Deshpande. We are in the Ayurved College Nigdi, Pradhikaran, Pune 44. Today is a Wednesday, that is the 2nd of March 2016. With me are the students of first year post-graduation or MD in Kriya Sharir, and these are doctor students. Dr. Kalyani and Dr. Snehal are there. Other students are working in the hospital for Prakruti determination. Today we have taken the topic as what can be the Viva or what can be the oral for red blood cell count practical in UG as well as in PG. And up till now we have discussed a lot about this Viva or the practical. My next question for the practical examination of RBC count: physiological variations in RBC count. There are always two things. RBC count can be changed physiologically as well as pathologically. So we must, as a physiologist, we must know what can be the physiological differences. One point we have already discussed. Tell me that point.
Male and female.
Yes, one thing as a gender wise you said male and female. Another we have already discussed.
Age
wise, that wise. Newborn different, after 1 week different, etc. Okay. Next, anything else? What can change the count? Always remember, our body physiology changes. You make a tag in your life. Yes, you want to say something? Our body physiological functions changes as per the day and night. That is called as a circadian rhythm. These words you must tell to the examiner. CIR, circadian. CIRCADIAN, circadian rhythm. There are another two words. All words you PG student must remember. Circadian rhythm. Second is biological clock. Biological clock. And third word is diurnal variation. DIURNL. Diurnal variation. All these words are the same. And it is the same concept as like Ayurveda. Yavanto hi loke tavantaha purushe. Whichever you see in the nature, it is happening in your body. The same principle is applied in modern physiology in some different language. They also believe when the sunlight is there, some cells at the base of the brain, they will get stimulated at the hypothalamus level. The system is called as a reticular system. So that reticular system, that neurons are situated at the base of the brain, and they get stimulated when there is exposure to the light with your eyes, and accordingly your body functions changes. You get awake. At the night, what happens? That light vanishes, disappears, sunlight. Again the cells got a hyperfunctioning and you get a tiredness, fatigue, and you sleep. So the same concept of Loka Purush Samya Siddhanta is explained by modern physiology in different language. And Ayurveda believes that each and every activity, or modern science believes each and every activity affects your body functions. Here we are talking about the RBC formation function or the circulatory function. In the daytime, sympathetic system is activated. At the night time, there is a parasympathetic system is activated. Sympathetic system is for active physiology, and parasympathetic is for resting physiological conditions. Resting, there should be slowdown. And that is why in the morning there will be less count, less hemoglobin, less WBC, less RBCs, because the requisite is less. There is no necessary. When you start working up, every movement in your life is like a battle. And every time you need energy. Every time, every minute you need the oxygenation. So you need more flow of the RBCs. Every time, every minute you get exposed to the dust, fumes and bacteria. So there is an order to our soldiers, be ready at all the time. So gradually WBCs will start increasing. So in the morning hours, all the stages are at the best level and gradually they start increasing till the evening. So more activation is not only with the day proceeds, but there is also stimulation for exercise. Exercise is a physiological function which stimulates your sympathetic system, alert system. You need more oxygen. Can you understand? When you do the exercise, you breathe not only with the nostril, but you open your mouth. Ardha Shakti Vyayam. So naturally RBC count will increase and WBC count will increase. Mental stress, what does it mean? When there is a mental degradation is there, wear and tear is there. So whenever you want to repair something at a physical level as well as mental level, you will need more energy. More energy means more oxygenation and more protection. So more energy, more oxygenation with RBC, more protection with WBC. So after exercise, count will increase. After emotional excitement, the count will increase. After the food even, the count will little bit increase. And now another question, tricky question, that is something one must be alert. Physiological decrease in RBC count. This is very rare. But one condition is there. Physiological decrease in RBC count in a person. I will give you one clue. This occurs only in the ladies. That's right. Pregnancy. Physiological decrease. Why? Why? That is called as hemodilution. Hemodilution. More blood amount is created, but comparatively RBC cellular particulate matter is less. The more blood is developed, but it is not with the RBC is equal. Now next question for Viva, RBC count is pathological variations in RBC count. Pathological. First we will talk about increase in count, which is also rare in the practice. What that condition is called? Increase in RBC count. That's right. Polycythemia Vera. Poly means more. Polycythemia Vera is increase in amount of RBCs in the blood. So what are the causes? No, first tell me when the RBC count will increase in physiological condition. Increase in the RBCs. Requirement will be more. Just now we have seen it, all the things. Just now we have seen it. What is that? Exercise. After exercise, that condition is also called as a polycythemia, remember. Then emotional stress in athletes, in newborn babies, as we have seen, count is more. So polycythemia is there. And most important practical level is higher altitude. Don't forget it. Higher altitude. Trekkers. When anybody is going for the trekking in the mountains, going for the trip of Himalaya, always tell him beforehand, that means previously, prevention is better than cure. You will get a breathlessness. So he must take the precautionary measures. The patient will suffer from the polycythemia in high altitude because of the low PO2, this word is important, PO2, pressure of oxygen. As we go up above and above than the sea level, our pressure of air becomes less and oxygen pressure is definitely less. Okay. Next, pathological causes, as you said very rightly about the polycythemia. First is lung and heart diseases. Lung and heart diseases, especially congenital heart disease. What is happening in the lung and heart diseases? The condition is called as a hypoxia. Remember, HYPOXI. Less oxygen. So this equation you must remember. When less oxygen will be there, what the body will try? We will produce more RBCs to carry the less oxygen. Fastly we have to carry out. Oxygen is less, but we have to supply. So we will increase the number of the people, working people, and they are RBCs. So whenever the condition is hypoxia, the RBCs are increased. Another thing, when the hemo concentration is increasing, is a dehydration in practice. RBC count you will find more, not less. In the cases of diarrhea, vomiting, gastroenteritis. So water is lost, udaka dhatu kshaya. Blood is formed with the two things, always remember, plasma and cells. And plasma is made up of mainly water content, 90% is water there. So water is losing, so blood is becoming more concentrated, that is called as concentrated. And that is nothing but more RBC count with compared to the plasma. Okay? And third factor is Polycythemia Vera, cause is not known, that is idiopathic. The people say, we don't know why there is a Polycythemia Vera, idiopathic. Of course, these cases will come less in practice. More problem is of less RBC count and which popularly known as anemia, Pandu. So this is qualitative and quantitative reduction in circulating RBCs. So now you tell me something about anemia. How you will diagnose the anemia clinically, provisional diagnosis in your practice. Which patient you will see that this patient may be having, we must give him the prescription of hemoglobin estimation in the lab. Go and do the hemoglobin or go and do the hemogram. When we will ask this patient, which are the patients, what are the complaints?
Breathlessness.
Tell loudly. Correct. First is breathlessness.
Palpitation.
So breathlessness, speciality of breathlessness, typical, any other additional feature of breathlessness? Exertional or dyspnea, exertional dyspnea, that means whenever he will do some efforts, exercise, then only he will feel more oxygen and he cannot get because of the less RBCs. But if he sits down like this, he may not feel the breathlessness. So Shramaja Shwasa, in Ayurveda it is called as a Shramaja Shwasa, breathless or dyspnea on exertion. This is typical feature. Why? Physiological answer. Exercise will need more oxygen which cannot be provided because the RBCs are less. He cannot run. He cannot participate in the sports. School going children, it will be brought to you. And the mother will tell that see, his teacher is not accepting him. And when we inquire why it is not accepting, he says that doctor is getting little bit breathless when he makes 2 rounds to the grounds. Then you will find, what is the problem? Then what next you said symptom?
Palpitation.
Palpitation. Yes, that's right. Any patient, especially young girls of 15, 18, 19, 20 years, they say to you that I am getting the palpitation. Then there may be anemic condition. What are the 3 important causes for palpitation? Vyavachedaka Nidam, differential diagnosis of palpitation. Because clinically also you must have the 3-4 causes in your mind. If the patient is only complaining that I am hearing my own heart sound, that is called as a palpitation. In Ayurveda it is called as a Rudadrava. Rudadrava. Vataja Samprapti is there. Vataja Samprapti. Vata Prakopi is there. There are 3 or 4 main causes. As you said very rightly, one is anemia. Second is ventricular arrhythmias. Ventricular arrhythmias. That is a problem in the electrical circuit of the heart. SA node, AV node, bundle of his, right bundle branch, left bundle branch, Purkinje. There may be some problem in the electrical conduction system of the heart. So ventricular arrhythmia that can be diagnosed by pulse examination. That means rhythm. Now you are talking about when you say palpitation, it may be pulse rate may be 100, okay, or 110. But you should note the rhythm of the pulse, whether it is regular or regularly irregular or irregularly irregular. That is what we are talking about, rhythm, and that is concerned with the ventricular arrhythmia. The next question in your mind should be hyperthyroidism. These ladies also get a palpitation. 25 to 35 years lady comes to you and says she is a palpitation. How you will rule out this hyperthyroidism problem? What you will ask to the lady? Simple 2 questions. Is there any weight loss? In last 3-4 months, do you find any weight loss in you? Next you will ask, Do you feel more hot all the time? In the cold season also you are feeling hot. So combination of palpitation plus weight loss plus feeling hot. These three more towards the hyperthyroidism. Clinically, one test you will add in it. What that test is called as? Yes? No, I am saying clinically. Don't go for investigations. Clinically, bedside diagnosis of hyperthyroidism. Tremors, always remember. Ask the lady to stretch the hands. Keep one paper on it, any newspaper or your paper, and you will find that paper is moving. So this is called as a tremors. Tremors with outstretched hands. That is hyperthyroidism. So you can understand we have started from the anemia. We are talking about the clinical presentation of anemia, and we are getting such a big knowledge of learning only one small word. So she has already told us one is a dyspnea on exertion, second she talked about palpitation. These two symptoms are very correct for anemia, and we have already talked about also the differential diagnosis. Anything else for the anemia? Clinically, bedside.
Pallor.
Exactly. But before that, one symptom you can add. Anything? One symptom.
Orbital edema.
She said periorbital edema. Yes, I also agree. That's also right. But it is not necessary periorbital edema. It can be the general edema as well because of the hypoproteinemia. Periorbital edema more going towards the kidney problem. And when edema on legs, edema on the hands, then it can be the hypoproteinemia. Okay? And anemia due to the hypoproteinemia. So that will cause the edema. Anything else? Karnakchved in Ayurveda says. Karnakchved. In modern it is called as a tinnitus. Ringing sound in the ears. This also one of the complaint in anemic patients. Ringing sound in the ear, tinnitus. Karnakchved in Ayurveda. It is mentioned. It is mentioned in the Pandu Lakshani. Now we will, as you said rightly, tell something about signs. Signs are very important and easy to diagnose the anemia. You said paleness. Where you will see? Which part you will check?
Sclera.
Sclera? No, wrong answer. Lower palpebral conjunctiva. This is very specific. Lower palpebral conjunctiva. Normally it should be pink. And everybody knows how we see. In front of the mirror you go and see like this, your eye. This part. Lower palpebral conjunctiva. This should be red or the pink. If it is white, definitely you are going towards the anemia. What else? Which part you will check for? Pandustu pita bhagardha ketaki dulli sannibaha. Pita bhaga, yellowish white. Nails, perfectly all right. Nails will be white. Perfectly correct. Palm, very correct answer. Palm, P-A-L-M, very correct answer. It will be also pale. What else? Tongue, always remember. But for the tongue and nails, I will add two more features. Do you know? For anemia, how the tongue is described. Tongue is described as a bald tongue. Always remember. If the papillae are lost, and it is like a alopecia, it's clean, no papillae, then it is pernicious anemia. Bald tongue is a very special feature of pernicious anemia. And about the nails, there are two more things. One is brittleness or roughness of the nails. Then normal nails, how geometrically they are convex in nature. Convexity is there in the nails. But if they are flat, that is called as a platysma. Flat nails. They are not convex. That suggests the moderate type of anemia. And there is another condition, the nails become concave. You know, these nails are having upward, and that nails become like this. They are called as concave nails. Another words for these concave nails? No, clubbing is different. Clubbing is different. Clubbing is not there. Concave nails means spoon-shaped nails. We use the spoon for eating. Spoon-shaped nails. And another very tough word, but it can be impressed to the examiner, koilinokia. Koilynocchi. Difficult word. Koilinokia. Koilinokia means concave nails. And this is a very specific pratyatmaka lakshana of Pandu Vyadhi or anemia. Koilinokia. And then you can advise him to do the hemogram. What is the difference in doing the hemoglobin estimation and the hemogram? What is the difference? Why we do the HbA1c? Why we do the hemogram? What is the report wise? What is the difference?
In hemogram we check blood indices.
That's right. In hemogram, we get everything. We get hemoglobin, we get RBC, we get WBC, differential count. Then you said blood indices like MCH, MCV, MCHC. All things coming under the hemogram. So for the first time, it is better to advise the hemogram than the hemoglobin for anemic patient, because that can help you even to confirm and diagnose another conditions. For example, if the patient is suffering from blood cancer like serious problem, leukemia, that cannot be diagnosed by hemoglobin. Then I have discussed already, if the WBC count is too high, like 1 lakhs and 2 lakhs, and lot of band cells are there, then you have to think for bone marrow examination. So always, but when your diagnosis is fixed that his hemoglobin level is low because his anemia, cause of his anemia is this, then for next 1 month or 15 days you can do only the hemoglobin estimation. This is the difference. First time investigations and follow-up investigations. This must be criteria. Now tell me the causes of which are the important types of the anemia or very important causes of anemia. Next question for Viva.
Pernicious anemia.
Number 1, she said pernicious anemia. What does it mean? Any description of it? Very correct. But we will, just excuse me, but we will go further. We will go this as a second type of anemia. What is the commonest anemia in India? So in examination, don't forget to tell common answer first and uncommon afterwards. That can make a difference. This person is the bookish or it's a practical oriented person. The examiner can judge the student whether he has any exposure in the practice or whether he has read only the books and not attended any clinic or something like that. So iron deficiency anemia should be the first answer. Why the iron deficiency anemia is common in India? Why? What can be the reasons? Yes, be quick. It's like your ladies' game, sanga, pick. Very quick.
As compared to other countries, Indians are more prone to vegetarian diet.
That's right, that is one of the correct answer. Indians are more vegetarians, so there are chances. But before that, we are developing countries and not developed countries. And developing itself suggests we are poor. It is true. Forget about our own. But many people are below poverty line. Many people don't get even the 2 times food for their normal food. We are not talking about hi-fi. But simple food, even they don't get the chapati, don't get the rice, they don't get the dals, they don't get the jaggery, nothing. What groundnut? Actually, you know that these basic foodstuffs are essential to having normal hemoglobin and RBC count. So undernourishment and malnourishment, these are the basic causes for iron deficiency anemia. Another important, still the ladies are getting more and more pregnancies, deliveries. Still, although we are talking that we are improved and we are thought are improved, but I find even in the cities, I don't want to quote any particular name, but there are the father and mother and there are the, what you can say, the husband and wife. Still today, they said that son is Kuladipak. So, till they get a son child or male child, they try and try and try. So, if you make a survey for my, again one research point, you will find many families are there, 2 first ladies and the last is a son, male child. 3 ladies and 4th one is a last male child. What it means? It means proved that these families are where they were definitely taking chances till they get a male child. In the villages it is common, but in the even cities there are many families like this. And that is why these ladies suffer. By repeated, as we have already seen, every pregnancy she gets a less hemoglobin or less RBCs. And so repeated pregnancy she will get definitely the less RBCs. And this is one part, physiological. Repeated pregnancies without any gap. Okay, you want to take a chance, but at least give a chance to recoup her normal hemoglobin. Come back. This pregnancy she has dropped down from 12 to 10. And she is again in the next 2 months she has got pregnant. Then what will happen? Again 10 to 8. Then again 8 to 6. So at least wait till the hemoglobin comes to again normal like a 12 and then get a chance of another. What is another reason for in the ladies to get anemia? In Indian ladies? Pathological reason. Many ladies are suffering from menstrual problems. Many ladies. You have to draw down by research, you have to draw down the percentage. How many ladies are suffering from the, I am not talking about, but I am talking about menorrhagia type of, means heavy menstruation. And you will find there are at least 20-30% ladies are suffering from heavy menstruation problems and that leads to the anemia. 4th important cause, in the Indian families, still it is a fact that mother feels that I can do anything or I can bear any stress. So I will sacrifice everything for my son, for my husband, for my father-in-law, mother-in-law, etc., etc. So when she cooks and when some remains for the next day, that is called as stale food, and Ayurveda it is called as the Paryushita Anna. Who is taking that last shidi chapati? Mostly the mother is taking that stale food and not any other. Rather she do not want to share that stale food with the other family members. This is a tragedy. Actually she should share. But why? No, I will take it, no problem. But then she suffers from the anemic condition. So stale food is another important reason. Then, so ladies anemia is common, iron deficiency anemia. But by chance, if you get in the males iron deficiency anemia, actually this is rare, remember, in our practice, very few time you will face that the male is having the anemia. Female anemia is very common. So tell me the very specific 3, then you must be serious. If the 10 years child or if the 20 years young person is having the 8 gram percentage, or a person of 40 years comes to you, senior citizen, and he is having the 7 or 8 gram percent, you must think of serious causes. There are differences. For example, if the child, 10-year-old child, what can be the cause in him? 10 years old child. The most common is worm infestation. Don't forget it. In children, the cause of anemia is worms. Helminth infection. You must do the stool routine examination and find out whether there is a roundworm, hookworm, tapeworm, whipworm, Giardia lamblia, Entamoeba histolytica, amoeba, Giardia. Rule out every possible parasite. And then only you give the Lohaso or Manduru. Unless and until you treat the root cause, the anemia will not be cured. Always remember. Suppose the person is of 20 to 25 years old. and he is having the 7 gram, 8 gram. What you will suspect? You have not done the hemogram, you have done only the HB. What you have missed? What can be the cause? It may be a case of leukemia, always remember. It may be a case of leukemia. Young person is there and he is having the less hemoglobin. Again in the group of 30 to 40 or 30 to 50, person is coming to you and his hemoglobin is, you find 8, 9, 10 gram %. What can be the cause? Right. So you can immediately ask him, Dr. Kalyani has rightly answered, piles, but that too bleeding piles and not the shushkarsha, but it is a raktarsha. Not the dry piles but the bleeding piles. So you can just ask him, आपल्याला बाकी कसला त्रास होतो का in Marathi? Do you have any other problem like hemorrhoids or the piles, and do you get blood in the stools, etc.? Any other cause? If the person is of 50, 60 years old and he is having the 7 or 6 gram %, all of a sudden you have found out what can be the problem and what can be the investigations. You can ask him only one single question. No. Ask the relatives or directly that person, बाबांना विचारा त्यांना संडासला कशी होते, काळी होते का विचारा, काळी. Ask the person whether he is getting black stool, senior citizen. What does it, black stool is called in modern physiology or modern pathology? Malina. What is the basic cause? Occult blood. This is also called as the occult blood, that is hidden blood. So there may be some ulcerative colitis problem. Ulcer in the colon, and that blood has been changed from red to black. So intra-abdominal bleeding is suspected. Intra-abdominal bleeding, and that is 2 drop by drop, Tibak Sinjan Yojana. It is not a huge amount, and that is why it is turning to the black after coming out of the anus or in the stool. So when the 50-year-old or above 50-year-old person comes to you for anemia, ask this Malina and then advise the stool examination and write down specifically to the pathologist. Remember, we usually write down stool routine, but add one word, please do occult blood test. This is mandatory. If the pathologist don't do it, your all efforts are waste. It is also called as a benzidine test. Benzidine test. So iron deficiency anemia is very, very common, and that is why we must discuss this point at this practical level. Second, Dr. Kalyani has already mentioned, which is called as a pernicious anemia. What are the another names for the pernicious anemia? It is called as a megaloblastic anemia. Megaloblastic. Why it is called as a megaloblastic? Why it is called as a megaloblastic? Size is more. Mega means big. Mega mart, mega store, you have already heard about it. Blast means cell. Megaloblastics, the size of the cell is too big. And what is the cause?
B12 deficiency.
Right. B12 deficiency. Why B12 deficiency? Go at the root cause. Why B12 deficiency? There is a deficiency of Castle's intrinsic factor. Very interesting name. Huh? The name of the scientist, Castle. C-A-S-T-L-E. These all details are expected from PG students, not the UG students. Castle's intrinsic factor. Where it is? Where it is situated?
Stomach.
That's right, stomach. And that's why the importance of Vagbhat. Vagbhat has added Amashayasham Pittam Ranjakam Rasaranjana. Otherwise, Yakrut Pliha were mentioned by Charak also, or in Hridaya also. But there is another reference of inclusion of Amashay as the sthan of Ranjaka Pitta. What does it actually do, this intrinsic factor? This is nothing but a protein molecule, remember. This is nothing but a protein molecule, biochemistry is there. And when we take any substance rich in vitamin B12, foodstuff, we take the foodstuff and B12 is a content. So this protein is attached to the B12 and then only they travel to the further duodenum, jejunum and ileum, and ileum will absorb B12 only when it is attached with the intrinsic factor. So intrinsic factor is helping the absorption of vitamin B12. This is the detailed physiological application. Intrinsic factor will help for the absorption of B12 from the villi of the ileum. And then of course this anemic condition will arise. Next cause is folic acid deficiency, that also Dr. Kalyani has mentioned. Folic acid deficiency in the diet. Next, two rare causes of anemia. Hemolytic, and you know very well there is a difference in hemorrhagic and hemolytic. Menstrual loss is hemorrhagic, or road accidents are there, that is hemorrhagic. But hemolysis means the cells are broken down, RBCs are broken down. And what is the commonest anemia which cause the hemolytic anemia? Subtype, that is called as sickle cell anemia. SICKLE. Sickle cell anemia is a very commonest anemia, and everybody knows that Ayurved College is doing very nice research on this sickle cell anemia project. These patients always need the steroids because this is autoimmune disease. Always remember, sickle, because the RBCs are become sickle shaped and they are fragile. They can immediately or easily broken down. So loss of RBCs are there, and to prevent this early breaking, the doctors are prescribing steroids sometimes. And in emergency crisis, what is called as a crisis, blood transfusion is must. So just to prevent the use of steroid or reduce the dose of steroid and to prevent the blood transfusion, Ayurvedic supplementary drugs definitely can be given. And as I am repeatedly telling you, you must use the Dadimadi Grita, Vasa Grita in these conditions. Then there is use of Daru Halad Ghanavati, which is also helpful to prevent the blood loss. There is another two drugs that I would like to share with you, experienced drugs. One is Bilva Churna, or if you get by chance the bell leaves fresh, then decoction is also helpful. Just crush the leaves, add some water, just like a tea, or bring a dry bharada powder from the Kastaushadhi, Bilva bharada, and make it a decoction. And another is Indragopa Kida Churna. There is one Indragopa Kida. You might have been remembering there is a shlok in Ayurveda to explain the redness of the blood. Indragopa Sakansham. So Indragop Kidyache Churna, powder of Indragop Kida, is also helpful to improve the blood count. Then last is aplastic anemia. What does it mean, aplastic? Aplastic means hypofunctioning of bone marrow. Your bone marrow is defective, and that is why production of RBCs and WBCs is not proper. Last few points we will discuss with very fast. As you talk about blood indices, you just tell me or you can write down these formulas, because many times we don't remember these formulas. In the pathological report we get ready-made reports. But as a student we must remember MCV is equal to, I think in spite of MCV, okay, MCV is equal to PCV multiplied by 10 divided by RBC count. MCV is equal to, MCV means mean corpuscular volume, PCV means packed cell volume multiplied by 10 divided by RBC count. The unit is cubic micron. Cubic micron, and normal count is 82 to 92. 82 up to 92. Then write down MCH formula. MCH, mean corpuscular hemoglobin. MCH is equal to HB multiplied by 10, HB multiplied by 10 divided by RBC count. I think formally remembering is easy because MCV and MCH both having the multiplication by 10 and division by RBC count. First is only PCV and second is with the HB. Okay. The normal value is 27 to 32 picogram, PICO, picogram. And last is MCHC, MCHC, mean corpuscular hemoglobin concentration. HB divided by PCV, HB divided by PCV multiplied by 100. Only the formula changes with 100. And normal value, have mentioned MCH unit is picogram. First was cubic micron, then picogram, and third MCHC is 32 to 38%. 32 to 38%. So these are called as a blood indices. This is also expected in PG level. And lastly, there is morphological report in pathological report, morphology of the RBCs. So accordingly, you must be able to recognize which type of the anemia. So that also we will make a short table. So you write down the morphology on one side and type of the anemia on the other side. Only small lines, few lines. First is called as a normocytic normochromic. Morphology will be normocytic. Hemoglobin will be less. For example, 10 gram %. But the morphological report was normocytic normochromic. I think you must note down the meaning of it. Cyte means the shape of or the size of the RBCs. So normocyte means normal shape or normal size, and normochromic means color is normal. Now you can see both are normal, but hemoglobin is less. The only probable cause is hemorrhagic, road accident, menstrual problems. Hemorrhagic anemia will be there. Blood loss is there, acute blood loss. So there is no change in the size, there is no change in the color. Are you getting? Only the volume is less. Next is microcytic normochromic. Only the size becomes small. Microcytic, but the color is same, normochromic. Infection is the cause. Remember, you must find out infection in the body, and that is why anemia is there. Infections. The cell size become less. Third will be microcytic and hypochromic, both. Size is less, content is less, color is less. And that is our common. Iron deficiency anemia is microcytic hypochromic. Now opposite, we will go macrocytic, size is big, macro, but normochromic. Macrocytic, normochromic. Just now we have seen B12 deficiency. B12 deficiency. And lastly, macrocytic and hypochromic. Now both has disturbed. Size is disturbed and as well as color is disturbed. What will be? First we know B12 and chromic we know iron. So there is a combined deficiency of B12 and iron. Combined deficiency of B12 and iron. And really, last question, tell me the treatment, dietary management of anemic patient. Tell me the substances, be quick. Which substances contain more iron?
Green leafy vegetables.
Green leafy vegetables contain iron, good. Another, there should be lot of list of the food stuff. राजगिऱ्याचा लाडू, नाचणी सत्व, very good. So नाचणीची खीर, especially I will talk in the summer season. Nachnichi kheer is the best recipe for 3 reasons. Nachni is good in iron. Nachni is good in calcium, rich, very rich. And Nachni is very cooling effect. So I will request all the senior citizens of age 40-50 having the leg pains, tiredness, fatigueness, and even your young girls, if they are having these problems, Nachni chi kheer daily in the morning, in the breakfast, in the months of March, April and May will reduce your fatigue, will give you the energy, your anemia will become cured and your calcium deficiency will be cured. So Nachni is very good. Next, Rajgira, as I have said. Rajgiraची वडी, Rajgiraचा लाडू. Then in the salad, especially beetroot. Beetroot is very good. Then chikki, Maganlal chikki. Groundnut and jaggery. Groundnut will give the proteins, jaggery will give the iron. So this combination is very good. So they used to use this chikki anemic patients. Then jaggery tea, gulacha chaha pya. Don't put the sugar, in spite of sugar you add the jaggery while taking the tea for the anemic patients. Then of course some small things are like, for example, wet coriander, kothimbir. It also contains a lot of iron. Anjeer, dry figs, they also contain a lot of iron. Kakavi, that also contains a lot of iron. Of course, we can make a lot of list, but only you must remember that there is some tricky question that UG students always answer for everything deficiency. They answer the milk, but remember, milk contain proteins, but milk do not contain iron. This is very specific. Milk iron content is very less. So I think this is all about today's lecture. Today is Wednesday, 2nd of March, and we have completed the RBC practical Viva questions in audio session 1 and 2. So thank you very much. Have a nice day ahead. Thank you.